excited for the break. All right, so we got one more group presentation. We probably won't get to it today. I think Monday. Make that happen Monday. Okay, let's see if we can do it Monday, just to be sure. Right? Other people show up. Maybe email your group members and let them know. All right. I'm gonna move along ahead to death and dying. We can maybe talk a little bit about late adulthood, but really, I'll kind of mix them kind of all together. All right, what is death? All right, many definitions of death. Are we talking about clinical death? Are we talking about legal death? How would that be defined? Are we talking about some sort of some spiritual aspect? Right? Many different definitions about death. Here we're going to talk about more of the clinical aspect of it and the legal aspect, right? Because usually death occurs within hospitals. So for all of you future nurses, you may have to deal with terminally ill diseases with patients, right? Patients who know that in some soon future that they are going to die. How will they deal with that psychologically? A little bit of understanding of the physical aspect, degenerative aspects of the brain, loss of brain matter that happens, loss of synaptic connectivity, right? Loss of organ functions, et cetera, et cetera. But first of all, our first introduction usually with death is from the loss of a pet, right? So I had my dog Chewy. I had Chewy for about maybe 11 years, and I grew really attached to Chewy. He was a Yorkie Lhasa Apso mix. Lhasa Apso are those dogs that look like moving rugs when they walk, right? The hair grows fast, like all the way down to the ground, so I can keep his hair always cut. But Chewy passed away last February, right? He had prostate cancer. All right, so he kept going through a lot of different issues, urinating, right? Incessant need to urinate, kind of like every few minutes he felt like he needed to, even if he didn't have to, right? Bleeding as he urinated, all these different things. So it was very sort of a traumatic time, especially with the kids. Right? So I have a 5 and 3-year-old, so it's kind of hard to explain to them, like, hey, Chewy is getting worse physically, right? His mood started to change. Cognitively, he began to have sort of erratic behavior, right? And so it was difficult to express that to children after he was euthanized. Euthanized, put down as we call it. So yeah, my youngest Chloe doesn't really understand what that means, like where Chewy went. Did we say he died? My 5-year-old has pretty decent concept that Chewy's not coming back anymore, right? And that Chewy was in a bad state. So it goes to show you that even that small gap, 5 to 3-year-old, there's a different sort of take on how we view death, right? The mortality. Here we're gonna have to focus more on the aging population, right? As we get into potentially 70s, 80 years of age, the average lifespan here in the United States is about 78 years of age. On average, we'll live to be about 78 years old. Men die younger than women. On average in the United States, men live to be about 74 and some change. Women live to be maybe around 79 or so, right? 78, 79. Asian Americans live on average in the United States to be about 82, 83. African African Americans on average here in the United States live to be about 72, 73. Right? So we say contextual factors, you know. Ethnic background counts of your lifestyle. Hey, what have you been eating your whole life? What are you have a propensity to have? African Americans have a propensity to have hypertension, high blood pressure, right? Diabetes, just from the lifestyle of our culture. Hey, how we eat, foods that we eat, our lifestyle, stressors, et cetera, lack of access to medical care proper, not going to the doctor, right? Even if you know you have an issue. So it's contextual. We go through different stages when we are getting to the end, or even know that someone is getting to the end that's close to us, right? Here's sort of our standard models, Kubler-Ross grief cycle. You've probably seen it before, stages of grief, stages of loss, as you could call it. It kind of correlates even if you lose a partner in any way. Say you had a breakup, right? Like, such and such, I was with this person for X amount of years, and now I have a loss, right? A bereavement, loss, grief, right? Okay, first we start off with denial. Hey, we have been told that we have a terminally ill disease, rare form of cancer that no one comes back from. Life expectancy, yet another year. Right? You caught it late, it's in stage 4. Right? Bone cancer, which is extremely painful. What do you do? How do you respond? Well, maybe that individual who's been told that information, and even others around them, like, hey, you know, you gotta tell your family what's going on. First one is denial. Right? Shock. Complete shock. Right? You've lived your life normal, and now you know that your life is going to end soon. So maybe you avoid. You're like, oh, okay, I can't really think about that. Whatever. The doctors don't know what they're talking about, right? I could bounce back from this. A little bit of confusion, like, hey, what does this mean? What does it mean to die? Fascinating. We're all gonna die. Right? Everyone we ever loved will die too. Think about that. So for your age group, you're like, yeah, I don't think about that stuff. Right? That doesn't cross my mind. I'm thinking about graduating from college. Right? The world is my oyster. I have everything ahead of me. But then older people in your family, like, their conversations probably surround a lot about, hey, you know who recently passed? Yeah, auntie such and such, uncle such and such, grandmother. Right? So we say, hey, there's a difference in how we move through these stages, because even the conversations, a lot of it becomes mostly about medical and health things for older people. Even at my age, right? I'm a young man in my 20s, right? I'm a young man in my early to mid 20s. I don't talk about this. But yeah, we talk about it. At my age group, we do talk about it, because people are losing their parents kind of around my age group. All right, so avoidance, confusion, elation, shock, fear, right? The elation part is this rush. Okay, this shocking news. Next is anger. Right? Anger about what? You're like, well, anger about everything. You're leaving. You're gonna leave people. You're gonna leave the family behind, your children, parents. You're gonna leave your lifestyle behind. You may have property. You may have all sorts of things. All the stuff you didn't do. Frustration, irritation, anxiety. The next is bargaining. Struggling to find meaning, reaching out to others, telling one story. To begin to kind of struggle, like, hey, what does this mean, and what does my life mean? And if so, have I told everybody about my story, about my life story? Typically, we go on YouTube, you can see all these interviews of people. A lot of them are older people trying to get their story out before they go. They're like, hey, I gotta tell as many people as possible. Fourth stage is depression, right? Helplessness, hostility, flight, being overwhelmed. Right? Go to a low state of consciousness, right? A low state of being, right? You get hostile, you're angry still. You have that hostility and the tendency to flight. And last is acceptance. I mean, finally accept that death is a part of life for everyone, and that your fate is sealed, and there's nothing anybody can do about it. Right? And maybe the meaning is that you lived. Right? That life was about living. And maybe you get into research and say, hey, maybe I'll write a book before I go. Right? Maybe you accept it. You're like, hey, all right, it's been a great life. I'm appreciative. I have gratitude. Look at all that's transpired in this lifetime. Why should I be sad about it? I'm fortunate. Like, hey, others may have died at childbirth. Right? All right. So yeah, I talked about mortality rate, right? Racial disparities in infant mortality and life expectancy, right? So we have a high degree of mortality for childbirth, particularly in minority groups. Once again, African Americans, Hispanic, non-whites, and life expectancy as well too. So we're talking about infants. We already talked about the causes of death. Usually is prenatal issues, right? Child is known not to kind of make it through childbirth even before is born, right? And then SIDS and things like that too. Adolescents and adults through age 44, usually death, leading causes of death for your age group is accidents, injuries, unintentional things, right? Car accidents, unintentional things, just extreme sports, doing hiking, mountain climbing, things of that nature. Middle adulthood. I say maybe my age group would be, hey, cardiovascular issues, right? Stroke, heart attack, things of that nature too, or lifestyle. And also unintentional injuries, right? Drinking, drugs, et cetera, get involved in things that may put you at risk. Death with dignity. Right? Some people want to die with dignity. They don't want to die as a feeble-minded individual. They want to die and say, hey, I planned all of this. I planned where I wanted to be buried. Maybe you've already paid for your burial. You know exactly where it's going to be. You've planned to secure your family financially. You've made a great plan, right? You're going to die with dignity because you've accepted that death is a part of life. Clinical death. So we define clinical death that if there's no heartbeat or no respiration for at least 10 minutes, right? There's no breathing and there's no heartbeat for at least 10 minutes. Clinical death. Whole brain death, right? Now the brain, if you hook up to an electroencephalograph, an EEG machine, right, you can see brain electrical activity, right, electrical chemical activity. So if we do not see any electrical chemical activity in the brain, we define that as a brain dead, right? And they can do tests. So usually they give you glucose. Remember, glucose is sugar. Sugar is energy. If we give you energy in your bloodstream, energy goes also, that glucose goes to the brain to produce like bursts of energy, keep your brain function going. So if they do that test, usually they'll be like, all right, we gave you some glucose and we still don't see any activity in the brain. Now we surely know that you did. Right? We've actually tried to induce or stimulate activity in the brain. There's a difference between brain dead, coma, and being a vegetable. That's what we'll call it, right? Vegetative state, coma state, right? Vegetative state is you're conscious. You just don't have any real great cognitive activity. So there's maybe less activity in that prefrontal cortex, that frontal lobe, right? So you're aware, you say, hey, I see the person, their eyes are open, their eyes are moving, you know? Sometimes we say, yeah, the mouth is grueling and open, but the person's still there, they're still alive. But they have very, very slow to little cognitive functions, right? I mean, it doesn't look like they're thinking. If they're thinking, we can't even really see it manifest in any sort of behavior of thinking. Now we say someone is in a coma, right? We say, hey, what is a coma? Well, you're not brain dead, right? You still have activity in the brain. But you may be on a ventilator, right? Like, hey, there's struggle for the brain stem, cerebrum to activate breathing and swallowing, right? If you can't swallow and can't breathe, we say we have to put them on a ventilator to help them breathe. We have to give them a feeding tube in their throat so they're able to have nutrition, right? There's still activity in the brain. They're just not conscious. There's no conscious activity. Meaning that we can open up that person's eyes, shine a light, nothing. They're still alive, right? But nothing. No movement or nothing. Close the eyelid back up. Vegetative state. Now people come back out of comas, right? You know, this is kind of a waiting game. You have to wait and see. And so we move on to like, hey, what do we do when people are finally at that state? Because maybe they're suffering. Should we help them transition to death? Like, do you want people to suffer? You're like, hey, I can't do that. I'm not God. Who am I to place, to assist them in dying? Controversial stuff, right? Well, this stage 4, like I said, bone cancer, very painful. At what point do you decide? Advanced directive. So, hey, important of communication and planning. It is important to try to plan with people who are terminally ill, have chronic diseases, or advanced age. Just try to plan. Some people have a living will, right? A living will means like, hey, this is I want to happen just in case I don't have those cognitive functions anymore. If I go into coma, this is what happened if I go into coma. Right? I want you to do this, 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 and that. And here's my health directives. Like, hey, if I'm on life support for at least 2 months, take me off. I don't want to be in there. Right? Pull the plug. Right? Make that decision, which we call, whoever has that, we call power of attorney. Right? The ability, the legal status to act on behalf of someone else. Right? Power of attorney. So that's the durable power of attorney. Really, the durable power of attorney is dealing with medical sort of assistance, right? Deciding on your health, making decisions on behalf of your health. Euthanasia, right? Assisting terminally ill with death, right? So like I say, hey, we have to put Chewy down, we have to put the dog down, which was, hey, we allowed this veterinarian to assist Chewy in his death, usually through the injection of some sort of drug, right? Which may be sort of a high degree of a specific drug that induced death, right? Which caused the person to die. Usually it has to do a lot of opioids. Remember we talked about opioid crisis? Really, opioids are pain numbers, pain removers, essentially, right? So essentially, it's like that. No pain, but you're given such a high dose, you're gonna die. But you're kind of just gonna fall into a sleep, a deep sleep, right? It's not gonna be painful. Opioids are extremely addictive, right? Sometimes they're not as bad though. In my opinion, they're not as bad as some of the other drugs. Because then opioids are like Vicodin. Anyone ever had Vicodin before? No? Vicodin is addictive. So when I had to have my wisdom teeth removed, they're like, oh, would you like to have the two that are like bothering you, or would you want to have all 4? And I was like, all right, I know I don't want to do this again, so let me just do all 4 at once. Like, take them all 4. I have to put you under. Right? Because it's so painful. When you come out, it's still really painful. right? You could feel like your 4 wisdom teeth have been removed. So I was on Vicodin for like 2 weeks. It's probably the greatest I've ever felt in my entire life. Yeah. How it felt was numb. It's like absolutely nothing in life mattered. Nothing. No bad news, no whatever, right? And it's just an over-the-counter, it's a prescription drug, So things like Vicodin and other drugs like that, very addictive. I wouldn't say they had a negative effect, to be like crazy behavior or anything like that. You just feel just so calm. You just feel like relaxed, which means it's big for the average person. Like you could just be on Vicodin all the time, just chilling. All right, euthanasia. Nancy Cruzan's death. Nancy Cruzan was an individual, a woman that had a Supreme Court case about the right to die. Do we have a right to put ourselves down? Do we have a right to tell people like, hey, give me the dose? Do we have a right to tell people like, hey, do me like Chewy? Give me that dose and let me go out again. I don't want to suffer. Right? They say, hey, law get involved, legislature, Supreme Courts, all the courts, lower courts gets involved in these decisions. To say like, hey, well, if someone assists you in dying, a medically licensed physician, is that murder? Right? A lot of physicians were doing it illegally before this was really addressed. Guys like Dr. Jack Kevorkian from Michigan, who was a medical physician who helped hundreds of people die who were terminally ill or in hospice care, right? Eventually he got charged with second-degree murder. But this case, Nancy Cruzan really brought it to the forefront. I'm like, hey, do we have a right to say like, hey, put me down, I'm suffering. Do me like we do the dogs, like we do the pets. And so it was addressed that, hey, you know what, the law says you need sufficient evidence, medical evidence to say like, hey, there is no cure for what you have, you're terminally ill, you only have a short window of life left, and those can maybe be the exceptions. Right, those are exceptions. I think about 10 states now allow assisted death, right? Physician-assisted death, right? So we have to talk about, we have to have these discussions. Passive euthanasia. So say my mom, who goes to dialysis for her kidneys, right? 89 years of age. If she were to one day tell us, as her children, I'm tired, I don't want to go to dialysis no more. I just don't. We would have to make a decision about, okay, Mom, you understand, the dialysis keeps you alive. If you don't go there 3 times a week, you're probably going to die really soon. Right? That's dialysis. Right? So you're like, hey, that is maybe passive, which means like, hey, I know I have something that's keeping me alive, and I'm just gonna stop taking it. You know what I mean? I'm just gonna stop taking the cancer medication. I'm gonna stop the treatment. I don't like it anymore. It sucks. It's painful itself. It's all these different things. Right? So that's passive euthanasia. Like these are real decisions as you get older and you start to deal with people who are going through really severe medical things. These are issues to be addressed, and they're very psychologically taxing, right? So it's a lot to be dealt with. And active is, really inducing that death, like trying to do something to enhance the death itself. All right, so I talked about Jack Kevorkian, the legalities, Death with Dignity Act, controversy about it, right? We allow people hospice. Hospice care is usually, once again, when someone has sort of a terminally ill issue, right? That's irreversible, that's not going to get better, right? It's very degenerative. We may put people in the hospice care. It may be a facility, right? To be like, hey, it's not senior living, but it's really there for people who who are known to have a very short window of life left, right? And all of that, in hospice care, you might think, hey, there are pastors and priests available, there's spiritual assistance there, there's medications, there's all sorts of things. But it's helped to kind of prolong the quality of life, right? To give you some sort of quality. Cultural rituals, right? We all may view death in a different way, and the practices along the way and during burial are different. Some cultures in South India have pyre ceremonies, right? They set the bodies on fire. And thousands of people come like a concert to watch the bodies burn, which here we call that cremation, right? But here there's a different little ceremony. Muslims wash the body, right? Before burial. Ancient Egyptians mummified the body, right? I'm thinking that, hey, you know what? The spirit may come back to this physical form in some case. So there's a variety. Right, non-corporeal continuation, right? Non-body continuation, non-physical continuation, right? This concept like, hey, there's no returning to this body, right? Some people may believe there's a return to the body. The body will regenerate itself at some point. I don't know, as Christians, you know, we kind of do have that viewpoint that at some later day we are re-emerged in the physical form. What that physical form looks like, no one really knows, right? That we would have some sort of resurrection after it's all said and done at the end of time. Right? Children's understanding of death, right? Some is contextual. Hey, how do you approach telling the children about death? You know, I try my best to tell the kids kind of the truth, right? Tell them the truth, but in a way that is not too shocking, like ease them into the truth. I just don't find it, you know, I felt as a kid, you know, you always feel like you're kind of lied to, right? Your parents always lie to make things seem good, and I don't think I appreciated that. So as a dad, I'm like, nah, I'm gonna give you the truth. They'll let me tell you in a way that I don't think will harm you mentally, right, or traumatize you or something. But yeah, but really about 3-year-olds can't really process the absence of a person in a physical form. They may can process that someone's not there, right, around them. But they can't process that someone's not coming back due to a death. Around 5-year-old, it does kind of emerge because a lot of their playing does emphasize killing. Right? A lot of their cartoon shows, things they watch on the tablet, people who died, shooting, death, mummies, right? All the vampires dying, coming back to life. They do kind of view and understand a little bit more about death in their own way. Adolescents, understanding of death. Seen as inevitable nothingness, right? When we say, hey, older adults, the older we get through that sort of pyramid of hierarchy and needs when we start to transcend ourselves. Right now, it's just about you, for the most part. In that pyramid, you are concerned about you, accumulating wealth, getting a great job, getting a degree, looking good, feeling good, the titles that come along, you want to feel great about you. As you get older and you've accumulated those things and done them, then you start, really spirituality and God starts to really take shape. You start to think like, oh man, okay, I did all this stuff, now what? Right? The now what's? You're like, well, man, what's the meaning to all this? Right? Adolescents view this nothingness. Older people say, no, it's not. There's a lot more, right? Begin to pay attention to a lot of things. One of the things I'll tell you is getting older, as you start to pay attention to what Carl Jung, one of our great psychologists, calls synchronicities. you start to see how things happen in your life are not coincidental. The younger you are, you're like, man, what a coincidence. The older you are, you're like, that's not a coincidence. Okay? Right? There's meaning behind why those things came together like that. Okay? Start to emphasize about that more. Okay? Start to pick up on it. Dying process, the trajectory of dying, right? Changes in symptoms. By the time you're 90, you probably lost about 14% volume of your brain. Your brain gets smaller as you get older. Remember we said that myelination, that fatty substance, that increases the volume, that white matter, that gray matter, right? Expands the volume of the brain. As you get older, it goes away. No more myelination, slower speed of processing. And now you're starting to not have that cognitive ability anymore. Like, man, I forget my keys all the time. Man, I forgot about this, right? And once you get to really advanced ages, people can't do simple cognitive tasks, right? Simple things. They can't drive a car. They can't do that. So think about it. We started off with the babies, and they had the basic functions of living, which is breathing, respiration, digestive system, and then they built up the cognitive. Now, as we get older, you start to see what goes first is the last thing you learn. The last thing that formed for you all is that prefrontal cortex, which makes us human beings. The first thing that goes is the prefrontal cortex. So at the end of life, you're only really left with the things that keep you alive. But all that grand wizardry of how you're going to be smart, intelligent, that's the first thing that goes. It's your thinking and your memory, which transforms your behavior. All right, so think of that theory, right? Last in, first out. All right, I'll see you on Monday. Yeah, reach out to your group, see if we can get that done on Monday. Just in case. I don't know where it's still. All right, everyone, have a great weekend.